Hi, I'm Kelly Villegas from Focus Neuro Rehab. Today I want to focus on sharing some cases that I've worked with over the years that were sometimes unexpectedly highly successful. The first case is that of Elaine. She was the very first patient I had for neurofeedback. She was a 6-year-old little girl with moderate autism. She was highly suspicious of new people and new environments. I offered her family 10 free sessions, primarily so that I could get my feet wet with neurofeedback. Initially, she was so hyperactive that the only way she would sit long enough for a treatment was to allow her to eat a corn dog. Not that I recommend eating corn dogs. We started with only 8 minutes of neurofeedback, and by the end of her 10 sessions, she was doing the full 30 minutes recommended. By that time, her hyperactivity had calmed enough that she no longer needed to be eating to receive her therapy. Elaine was a fast responder. She went from a one-word vocabulary of no to speaking full sentences in 10 sessions. This experience reinforced my commitment to neurofeedback and opened my eyes to treating autism spectrum disorder with confidence. The second case is Richard. Richard was a 6.5-year-old little boy. According to the Vineland 2, he was functioning at about a 3-year-old level in the areas of receptive and expressive communication, personal daily living skills, and gross motor skills. In only 18 sessions, his Vineland showed dramatic improvements in receptive language to 11-year-old level. Daily living skills and gross motor skills also increased to a 5-year-old level. The next case is Alexa. Alexa was diagnosed with moderate to severe autism at a young age, but came to me at about the age of 8. Her symptoms were emotional meltdowns, the inability to be calmed, screaming when she did not get her way, minimal verbalizations, bedwetting 2 or 3 times a night, and being unable to follow directions. After only 6 sessions, her mother came to me saying, "Thank you so much for what you've done. Our daughter hasn't wet the bed since we started coming here." Unbeknownst to me, they had been layering her bed with 3 layers of waterproof mattress pads and sheets, despite using pull-ups at night. They would literally check on her several times every night and not only change her, but change her bed sheets and mattress pads. I saw Alexa for about 4 years due to her severe issues, but by the time she was 12, she was fully integrated into a regular classroom. We were successful at helping her to avoid medication, and she was able to thrive through the use of the neurofeedback. Then there was Leslie. Leslie was a 5-year-old girl with mixed issues, but no clear diagnosis. She was a super fast responder. Within 13 sessions, she went from a score of 102 on the Brown ADHD scale to 45. Her short sensory profile scores went from a definite difference to a typical performance. All her Vineland scores improved to within her chronological age equivalency. She finished her 40 sessions and she did not need to come back because her brain had learned to self-regulate. Then there was Mark. Mark was a 12-year-old boy who came into my office via a neurologist referral. He had been having severe migraines for the past 2 or 3 years, and they became more intense with any kind of increased stress or sunlight. He loved playing baseball and had been told by a previous neurologist that he would never be able to play ball again without the migraines, so he should just quit. Upon hearing this 12-year-old boy told his mother he would rather die than not be able to play baseball. On the day of his intake, he reported a 5 out of 10 migraine. I asked him if he was ready to get rid of his headache, and he nodded with tears in his eyes. 5 minutes later, he had no headache. Within 25 sessions, we were able to wean him from the neurofeedback, and now he plays baseball with no headaches and is no longer suicidal. The last case I want to tell you about is Glenn. He came to me as a junior in high school. He had been diagnosed with Asperger's syndrome around the age of 8. His mother, who was a kindergarten teacher, had always supported him and done her best to help him with his challenges. Glenn did not believe that neurofeedback was helping him. and one day he came to us claiming that we were trying to brainwash him. He thought we should not be trying to alter his brain. And instead of belittling his illogical statements, we patiently explained to him in detail how neurofeedback works, that it would not change him as a person, but would help him to calm his anxiety. Reassured by our caring attitude, he began to trust us and agreed to continue training. After finishing his initial intensive phase, he continued coming in once or twice a month because he was more of a slow, steady responder. He went on to enroll as a full-time college student at a major university. He was fully supporting himself by working at the technical department of the university. He became more social, groomed himself appropriately, and began to enjoy work and school. In short, he was thriving, which was so gratifying for all of us on his case. My hope in presenting snapshots of these cases is to demonstrate the efficacy of neurofeedback for treating autism spectrum disorders and others. This work is highly rewarding for me, and it has become a huge passion for me. I would love to be part of your journey to a better brain. So call me up 407-951-4280 and ask me how to get started.